Yeah, our next speaker is well known to all of us. Is Dr. Jamaluddin Hassanian. He's Assistant Professor of Plastic Surgeon at the King Saud University. And he will talk about something that you might, some of us, may not believe in it. But I think it will be good to hear more talks about this. How far we are from the laser lipolysis, I think we have to differentiate well. And I'm sure by his talk, we will, have the idea, can we take fat by laser? Or should we just go back to our traditional liposuction and do it well? Patients always ask for laser. When they phone to the private clinic or to the hospital, do you have laser for liposuction? If you say no, even if you are good plastic doing, so this is why some plastic surgeons, they say, oh, we have to go to this field and to know more about laser. I think, does it cause tightening only, or does it cause liposuction really? I think all those questions, I'm sure, in this excellent day, and I would like to thank Dr. Shlash for holding this really one day to have conclusion. Should we go to this field? As a dermatologist, we don't know nothing about laser liposuction. Or should the plastic surgeon get in this field to have more tightening, which is the main problem for liposuction, skin redundant? So I think I would be excited to know at the end of this day, what's the conclusion? Should we go to this field, or should we not listen to our doctors?
First of all, I'd like to say hello to everybody, all my colleagues, and I would like to thank them today for giving me a chance to show some of our experience on laser and liposuction. Okay, first we have to go into some definitions. Laser-assisted liposuction. This is to deliver energy into the subcutaneous tissue by an optic fiber, which is the laser, and that could be done before or after doing your conventional liposuction. Or you could do a laser first in this tissue by the optic fiber without the conventional liposuction. That means we leave the fat for the normal macrophages and lymphatics to remove that. Of course, there are special indications for each one. And this laser lipolysis is important if you have a minimal amount of fat, and it's also done in your clinic, done in your office, where if you do a conventional liposuction afterwards, you will cause more tissue trauma, and you may get more swelling post-operatively. But it's better to use it only on selected cases, but you still have to take care with it. Okay, there's a wavelength. The one we're using here, or the one I'm using at the moment, is the 918 nanometer, which can go deeper compared to the other laser lights, which is 1320 or the 1444. Of course, and it's more homogeneous than the other ones. That means it spreads deeper and it goes actually more wider into the tissue. Whereas the other ones, the 1322 or the 1444 lasers, the tip is the one that gets very hot, and the ablation actually of the fat is only at the tip area. The indications: treatment of fatty tissue in areas with target of the fat reduction, or treatments of area where there are thin deposits of fat, or treatments of area resistant to conventional liposuction or with poor response to conventional liposuction. There's also treatment of area which has been previously had the conventional liposuction and persistent skin laxity. Now everybody's talking about skin laxity. Skin laxity, of course, we say that the lasers do improve the skin laxity, basically by heating up the collagen and causing later on fibrosis and the skin laxity. But we also have to take it really into consideration that skin laxity is variable depending on the skin type and the cause of the skin laxity. In patients who have massive weight loss and a lot of skin laxity, nothing can replace surgery. And that should be actually taken into consideration, and we have to be quite honest with the patients when we offer them laser for skin laxity treatment. Contouring the areas with deformities of previous conventional liposuction. The preoperative preparation is normal like any other equipment that we use for the liposuction. Of course, disinfection, and we use usually the Thompson technique. Of course, it's better to do this in a sterile operative theater. Lipolysis can be done at either a 300 micrometer fiber or 600 micrometer fiber. Now, what's the difference between these two fibers? The 300 micrometer fiber gives you less energy, and it's better used for the areas like around the neck where you don't really have that much fat. And the 600 micrometer fibers give you more energy in areas where there are lots more fat. And of course, the 600 nanometer fibers produces more heat. And there's always a learning curve in this. As Dr. Laisa said, we shouldn't directly go into this unless we've really been trained to do this, because you can cause a lot of trauma and a lot of damage. Scalpels, 11 blade. Of course, if I'm going to do a assisted liposuction with a laser, I would go for an 11 blade. But if I'm only going to do a lipolysis without excision or actually conventional liposuction, it's sufficient to use a gauge 18 needle, because the probe of your laser is very, very small. A gauge 18 needle, if you just make a small hole, the probe will go inside. And then if you allow the energy, it will actually slide very nicely into the tissue. Spinal needles and other things, that's all important, but of course we have to stress that even in the laser liposuction, we have to use compression garments to reduce the dead space. You can't use them without compression garments. Medications for liposuction with local anesthesia, of course, dormicum could be used, especially if you're going to use it as a sedative, but any of these sedations, if we use it even in our office, we should be equipped at least with a pulse oximeter, a dynamap, and resuscitation. Otherwise, we would not try to go into these really sedatives, because they could be dangerous if that could occur in your office if you're trying to do it on local anesthesia. The Thomason technique, 0.9 normal saline, 1 liter, 2% lidocaine if you're going under local, adrenaline is only 100,000 ml, and 8.4 sodium bicarb. This varies from one surgeon to another. Some people like to add triamcinolone, I personally do not. But some people will add actually a bit of triamcinolone as well to reduce just the inflammatory response post-operatively. The Thomason technique, how much fluid to give. Usually the suggested is about 150 to 250 ml per area of 10 centimeter by 10 centimeter. Slowly you will acquire your own taste and how much solution to give. But this is probably an average that you give in that area. The incision points, more volume is usually required with local anesthesia. I would not go for the dilute anesthesia, but you can use, let's say, 1 ml of just 1% xylocaine at the site of incision. The patient will feel less pain. Less volume is required for liposuction. It is not performed. So if you're not going to do actually a liposuction afterwards, then you require less volume. You won't need that much. Anesthesia is like any other anesthesia. It should be given in a fan shape in the subcutaneous tissue. But we also have to take consideration, especially for our junior staff, is that when we give the anesthesia, give it time to work. Wait 5 minutes. Give time to actually also get the vasoconstriction that you've used. Don't just inject and immediately go in with the liposuction. What happens like normal liposuction, of course, we move tracts of fat by either by the laser itself, will actually dissolve areas in small little holes. That's why we have to get in 2 different directions. And after removing or dissolving the fat in that area, of course, we use the pressure garment, and this is collapse the area there. And then after about 6 to 8 weeks, you get a new contouring of the area. How to do it and how to mark, this is more for a junior staff. Of course, you have to use the pinch test to see how much fat there is, and make sure that the fat is in the subcutaneous tissue and not in a different plane. It's also very important that you mark the maximum fat while the patient is standing, not while the patient is lying. You get a better image if you try to mark the patient while he's standing. And mark the area, for example, here is the more fat that will be removed on the outer layer. You should also take into consideration, never try to go over this line here. If we try to go over this line, where is this pointer here? In this area, even though we have fat above and below it, what will happen is you loosen up all the skin attachment that is there, and the whole buttocks will just sag down. So it's better if you remove the fat on top separately, separate incision, and the fat below on a separate incision. You insert the fiber into the handpiece. Of course, it's very important to keep about 5 to 7 millimeters of the fibers outside the handpiece because it does produce heat, and it is in the metal sleeve. If you lose less, the metal sleeve itself will become hot with the treatment, and this could cause burning of the skin. And of course, this is the way it should look, the fibers. This is the way the light should look in the pilot light at the end of the fibers, which you check before doing. Of course, usually the suppliers would always like you to use a new fiber, but that costs a lot of money and not very practical. And with use, you get dispersion of this light at the end, which you have a special tool to cut the tip of the glass fiber to make sure that your fiber is giving the rays right in the middle. The dioid 980, oh, we go back. Okay. Dioid 980 nanometers, you have to check the function to use the correct mode. The unit that I have, which is the Quattro Star, has of course a special setting, and that can be used either in a burst mode or in a continuous mode. So we have to actually use it. I like to use usually the continuous mode in most of the treatment, but occasionally where there's a lot of fat, you can use the burst mode, and this one to disrupt the fat a little faster. Safety goggles, again, we have to use the proper safety goggles and make sure that everybody in the room is wearing safety goggles, and the patient should have the lead eye covers, and they should be actually fitted properly that the patient is not seeing any of the laser, whereas we have to take care of his eyes as well. The red aiming beam or the pilot light, most of the units available in the market have an on or off pilot light. This 980 dioid actually has one that's adjustable, which you can increase and reduce the intensity as you need it. The method of liposuction, it's all known to all of you, should be done more than one incision, so we get in 2 different planes to get a better result. Quick forward and backward movement should be done. We never try to keep the probe in one area, otherwise we'll get irregular areas, especially if you keep the area in one area, you'll get more fat removed from that one area. Usually, this as a learning curve, you just have to have smooth, swift movements around about 10 centimeters per second. Now this chart is an important chart. This is a recommended amount of energy to use. Of course, this unit that I have as well has a special what they call Varix, which you can put on a continuous mode, and this can calculate how many joules you gave to the patient. So this is just like a quick guideline to tell you how much is the recommended joules that you should give for removing fat in that one area. For example, the chin should be about 11,700 joules, the abdomen around 24,000 or 25,000. Of course, it depends on how much fat there is and what exactly you want to do. Another way to calculate the joules, of course, you can do it by time. For example, if you set your machine at 6 watts and you do it for 7 minutes, you'll deliver around 2,500 joules. It's variable from one unit to another, but as I said, this machine that I'm using has a Varix that can actually calculate how much joules you give as an accumulative in one area. Now, what is the advantage of the dioid 980 comparing to the other conventional liposuction? Okay, the volume reduction and skin tightening. Again, we said the skin tightening is variable from patient to patient, and actually on the quality of the skin, the age of the patient, and how much skin laxity you do have. It is smoother in skin and with less deformities. It's faster healing because the rays is actually diffused. It's not in one area. Less bruising because of the good hemostasis. Minimal blood loss and swelling because of less trauma. With a wavelength of 980, we can go deeper compared to other wavelengths. Okay? And it's more homogeneous and more safe. As we said with the other ones, using the Nd:YAG lasers, the power is basically coming only at the tip. And as you move the tip, that's where the energy is. This gives you a more diffuse power, can go deeper, and the heat is actually separated of all the tissue. It's not at one point. So that's safer and has less liability, of course, to damage the skin and get skin necrosis post-operatively. Shorter treatment time for the high power. This unit that I'm using as well goes up to 25 watts. The other units can only use about 18 or 20 watts. If we look at some of the patients done on this unit, we can see that this patient here, for example, was a laser lipolysis. There was no conventional liposuction afterwards. We delivered here about 6 watts with a cumulative energy of about 7,600 joules. And this is 6 months post-treatment. Here's another patient which we use laser lipolysis without removing actually conventional liposuction afterwards on her saddlebags, and she seems to be, we delivered here about 15 watts, and it's about cumulative about 25,000 joules. Now this is a patient here, of course, which we see quite often, but she has good skin type, she has moderate laxity, and in these patients you really get very good skin tightening on them. And this patient had a bit of fat, so we did actually laser-assisted lipolysis. We did the laser for dissolving the fat, and after that we used conventional liposuction, and after that all, we went down very superficial to increase the temperature and activate the collagen to cause a very nice skin tightening. Here's another patient who had quite a lot of subcutaneous fat anteriorly. Of course, what we did here, we did also a laser-assisted liposuction, and we did also a bit of, the patient also wanted to have a bit of a six-pack, in which we did these two semi-lunar lines. We went very, very superficial, and that caused them to make adhesions and simulate like if you have a six-pack. Here's another patient here with a bit of lipodystrophy, in which we did also a laser-assisted lipolysis, and she got quite a good result within 6 months. Another patient, again, a laser-assisted lipolysis with 6 months follow-up. Again, this is a lady who was a more elder lady than the first one, and she had also a laser-assisted lipolysis. We didn't do just the lipolysis alone because she had more fat in that area. So actually, we did the laser to dissolve the fat, we did a conventional liposuction to follow, and put in a pressure garment, and she got quite a good, reasonable result. Thank you very much.